Welcome to Fix and Play podcast. My name is Pavel Samsonov. I'm a performance physiotherapist for Essex Cricket County and I'm the host. Today we're going to talk about the educational path in the sports medicine in different countries, together with my brilliant group mates from UK and Barbados. We're going to discuss how sports physician education is structured in different countries and what are the path and interesting routes are available for them to get through this wonderful specialty. Stay tuned and you're not going to be upset with this one.
Hello, good afternoon,
Yeah,
everyone. My name is Rondell Hurley. I am a medical doctor from Barbados, which is a small Caribbean island, which is just below United States, next to Central America in that area. And although we are close to the United States, we were actually a British colony back in the slavery days. And so a lot of our educational system and a lot of our traffic laws, a lot of Barbados has fallen under British style. So that is how I got to the UK to do my studying. All right.
great. Could you tell me, please, about your background as a medical doctor in terms of just your story? How did you start it and how did you go to school, etc.?
Okay, so in Barbados, we have a free educational system. We're very lucky that our government funds for us to do both primary, then we have secondary, and then we go into tertiary care. So tertiary care would be like what you would call sixth form, or in Duggies, in the UK, that would be like grade, I think it's 11. And we do CXCs. And so when I did my CXCs, I got into sixth form, and then I did CAPE, which is Caribbean Advanced Proficiency Examination. And by doing that, that's what got me into university. So from sixth form, I went straight into medical school. So basically, it's high school to medical school is what I did. For a lot of international students, however, that is not the way that they go. They have to do a first degree first and then get into medical school. So there are a lot of different pathways to go. So you don't have to worry if, you don't have the grades for it straight out of high school. You can do a first degree and then go and do pre-med and go into medical school. So what I did is I went straight from high school to university. So I did my 2 years of CATE, and then I went to med school. But my med school program is 5 years.
Mm.
So yeah.
Sorry for interrupting you here, because basically we have the same thing. We go to the uni straight from the high school. The things that you were mentioned is it source of like exams or like A levels in the UK?
A levels, yes.
Yeah.
So the
So
equivalent of A levels is what our A levels are called CATE, and the UK is called GCSE.
and so yeah, just for listeners, so it's going to be a bit clearer in terms of the A levels. As far as I get it, they pick like let's say like three modules that are important for them to study in uni, such as like biology, chemistry, etc. Is it the same thing in Barbados?
Yes, so I did personally biology, chemistry, mathematics, and environmental science. That's what I did. I didn't do physics, but some persons do physics instead of the mathematics.
And how then does it work in terms of like entering to the uni? I'll give you an example. So for instance, like in our country, you pass like three exams, like which is Russian language, biology, and chemistry, and then you compete. We have like also our higher education is funded, so basically you're competing for those like let's say like free spots in the uni, and if you have like higher grades for your final exam, you got into these free places. If you don't, you have to pay for your education. How does it work in
Oh,
Barbados?
so similarly, so like I said, in Barbados, we're very lucky because our government actually sponsors majority of the local students that get into medical school. To get into medical school, you have to have at least three CXCs, at least, and you have to have passes in mathematics or physics. You must have biology and you must have chemistry at A level
Mm.
in order to get into medical school.
Yeah, that's kind of interesting.
Yeah.
And in
And
terms
if
of,
you get them at the highest grade, then you would get something called a scholarship or an exhibition, and they would basically give you money to go to school.
oh, that's really
Yeah.
interesting.
Yeah.
Yeah, so they would. pay you in terms of like while you're studying at the medical school or?
They will give you a stipend to help
Oh,
like buy books and laptops and that type of thing, as well as pay for your tuition. Yeah.
hmm. That's kind of similar because we have the same thing. If you're studying on those like funded places, you're gonna get those stipend, which is
Yeah.
gonna help you. But it's kind of like a bit ridiculous in terms of like the money that you get for those stipend. But it's yeah, it's
Yeah.
still is.
Yeah.
And
Yeah.
how does it work in terms of your medical education? How has it been structured? So, for instance, like we have our fundamental studies such as like anatomy, histology, pathology, like during the first 3 years. Then we have those like let's say like clinical rotations.
Right. So it depends on the university that you go to. There are five main universities in the Caribbean. In Barbados itself, there are two. There's the University of the West Indies, which is the one I went to, and then there's Ross Medical School, Ross University. I don't know if you've ever heard of it, but those are the two main ones in Barbados. There's also one called the American University of Barbados, not as popular, but that is a US-based medical school in Barbados. All right. For UE, the first 3 years, sorry, are your basic sciences, anatomy. I actually have my transcript here pulled up so I could tell you what. So it's anatomy, we do biochemistry, we do introduction to community health, we do pharmacology, because you know the drugs you have to know. And that would have been something new that you would have never done before in your A levels. And then we do the physiology of all the different systems. So all of those are what we call the preclinical years, the first 3 years of medical school. And then the last 2 years, what we call the clinical years, those we would then focus on the pathology more of each system. So you do pathology and microbiology in internal medicine, pediatrics, you do psychiatry, dermatology, you do applied pharmacology and therapeutics, social and preventative medicine, which is more like community medicine again. You do orthopedic surgery, radiology, ophthalmology, which is eyes. You do ENT, which is ears, nose, and throat. We do anesthesia and intensive care. We do accident and emergency. So a lot of emergency type scenarios and situations we would do in the emergency department. That's where we get a lot of our suturing skills in because a lot of things come in, a lot of trauma. And then we also do venereology, which is the study of sexually transmitted infections. And that would also extend to things like tropical diseases, which is a very common thing in this part of the world.
Mhm.
So things like dengue fever, Zika, those type of things that you wouldn't see in Europe as
Oh,
common.
we have our own infectious diseases. We have a bunch of them, because basically they're yeah, that's source of like one of the toughest modules that we have like in our medical school. Because yeah, I think do you have like microbiology or something?
Yeah, we do
Yeah.
pathology and microbiology by itself, and then we do pathology and microbiology as a part of each of those subsets I just called out.
Oh,
So
well, basically,
yeah, so any pathology of any subset of medicine we would do in those final 2 years. So
right.
typically after year three, you know how you would have like a summer break? There's no more summer break after year three. It's just go, 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 go from there.
So do you have your, let's say, like clinical placements in summer, or how does it work for you?
So we started with hematology in the summer. And then from September, we started the pathology aspect of it. We did a clerkship in the hospital where we went to the morgue and we got to work with the slides, preparing slides and examining different things under the microscope and basically relating all of those subsets of medicine and the pathologies that you would see in those different subsets of medicine.
Oh, right. So basically, it's very similar to what we have like back home. So basically, the medical education, I think the only difference is that I think some of the modules could be like maybe grouped like in different fashion, like pathology and microbiology. We have like a lot of distinct modules in terms of
Mhm.
like preclinical studies. And with regards to the summer breaks, we don't have it since the first year because basically, I mean, we have it, but it's like everything is tough in Russia. I mean, your life is tough. So basically, you have like I think your first year you finish your medical school in the mid of June, Then you have like roughly 4 to 6 week of let's say like placements, and then it's just like month and a half like every year that you have like off till the beginning of September. So yeah, it's kind of the same thing. Yeah, great. Thank you very much. And in terms of the after these 5 years, do you officially become a doctor, or how does it work?
So you are qualified as a doctor theoretically and educationally, but you cannot practice until you've completed your year of internship. So we have a 1 year mandatory internship that we must complete before we are eligible to practice.
And so basically, after you complete this 1 year of internship, would you go after that? I mean, like technically.
So you can decide if you want to go into whichever subspecialty you want to after that, because then you will be a general doctor. So if
Hmm.
you want to stay in the general medicine or what we call now family, because nobody does general medicine anymore. Family medicine is actually a subspecialty on its own now. So if
Hmm.
you want to go into that, then you'll go and you'll practice family medicine, or you can do more studying and you can specialize as a pediatrician, a general surgeon, an ENT doctor, a sports and exercise medicine specialist. You can, whatever you care to do, you go ahead and you continue you can choose to if you want, or you cannot. You can just work as a general doctor.
All right. And for instance, like when you pick your specialty, how does it work then? Do you have to go to residency or?
Yes. So you in order to specialize, you have to do residency. Everybody doesn't do it. More and more people are veering towards doing residency because it's more exposure. You're doing your continuing medical education, which is important. And, there's nothing to lose basically from expanding your knowledge. So more and more people are doing residency, even if it's a residency in family medicine, it's
Mhm.
still, yeah. And so for residency, what you have to do in Barbados is not
Mhm.
this as in
The rest of the world.
yeah. So in Barbados, basically we have one teaching hospital and we have certain specialties that have residency programs. We don't have residency programs in everything, sports medicine included. We don't.
So
So that's why I
basically,
had to travel to do my
ah,
sports medicine master's. And if I wanted to do a residency in sports medicine, I couldn't do it in Barbados. I would have to do it overseas.
you have to do it overseas. So yeah, basically, just to sum up in terms of residencies, if you have the specialty, if there is like no specialty you want, like in Barbados, I mean, the study, the residency on the specialty, you have to travel somewhere else to get this residency, right?
Yes. And that means doing whatever exams that country requires you to do.
Yeah, we'll get back to it. Now,
Mhm.
if Doug is ready, we'll go briefly through the same route, like how it works in the UK. Uh, hey, Dougie,
Yeah,
could you hear
sure.
me? Great. Could you please give us like a quick introduction of yourself, and then we'll go through some questions related to the how'd you go into medicine in the UK?
Sure. Hello, my name is Dougie Williamson. I am from the United Kingdom and I completed my medical degree in 2021 in London. I've worked as a resident doctor for a few years now and completed the Masters in Sport and Exercise Medicine last year.
Good. So basically, in terms, oh yeah, by the way, like quick off top, we have our chat in the WhatsApp, which is called like Being Late, Team Being Late. Because every time we tried to collect together, we were always almost on time, and that's kind of like how we try to do it now.
We're in
Yeah,
different time zones.
yeah, we're different time zones, and we did like a great job trying to connect now. So thank you guys again. In terms of your experience and education, how does it work when you go from the high school to the uni? What do you have to do in your high school to get to the medical uni in the UK?
So it's probably slightly different in the UK to what it is in other countries. But high school or secondary school, as we call it, is from ages 11 till 18. When you're 16, you have a bunch of examinations. And when you're sort of 17, 18, you have a bunch of examinations. And in order to get into medical school, you have to sort of do well on both of those sets of examinations. So the minimum standard is, well, when I was studying at school was three A's, which is now it's been changed to numbers. So you have to get three eights or three nines, I believe. But yeah, the standard's quite high to actually get into medical school.
Sorry, Dougie, for interrupting you. 8 out of 10, right?
Three A's, so that's the grade,
Ah,
and eight. They've now changed the grade to numbers, and
hmm
which I don't completely understand the system, but I believe it's eights or nines. Um, I think the maximum is actually nine you can get.
hmm hmm Good, sorry. And then when you pass all those exams, how do you get then selected to the uni? Is it on the basis of who got the best grades, or is there something else besides that?
So most universities in the United Kingdom will invite students to have an interview if they have good grades. So they will look at your application, and if your grades aren't up to standard, they won't invite you to interview. But if your grades are at a minimum standard, then they will invite you to their interview. Every university is different and has different standards, and they also base the invite to interview based off a other examination which you take. You can either do an examination called the UK CAT or the BMAT, and different universities like you to do different either of those examinations, and you have to score high enough on those external examinations as well to get an interview. But once you get an interview, I mean, you just have to perform the best you can, and hopefully they will then give you an offer afterwards.
As far as I know, they also take into consideration your source of like motivational. I was going to say interview, motivational. What do you call it? Like letter. So basically, which explains like why you fit like for this role.
Yeah, the personal sort of statement that you
Oh yeah.
make on these letters, and it is important. Some universities look at it more than others. If I'm entirely honest, I think most universities screen students based on grades and this external examination that they do.
Mm-hmm.
But of course, it's good to have things on your personal statement to show an interest.
Mm-hmm. But so sorts of like the competition is based mostly on your grades and like who has like better grades gets into the uni. Uh,
Exactly.
yeah, because I think the thing we discussed before is that in the UK when you have those grades, I mean, oh yeah, makes sense. Yeah. Yeah, thank you. And in terms of your medical unit, could you please give us a brief overview of how modules are structured, like starting from the year one to the last year?
So the curriculum has changed, I think, a lot since I was at medical school, but ours was very much in the first 2 years we looked at the foundational sciences. So we didn't really touch on the clinical side of things that much. And we had a little bit of hospital and GP placements to give us a bit of clinical exposure, but it was very minimum. In third year, it was sort of a massive transition. So in third year, you do half at the university, half on placements. So you sort of are learning in the classroom, but also learning within the clinical environment. And then the last 2 years are purely clinical. So you're always on placement, um, all in lots of different specialties, trying to get experience in as many things as possible. And at that point, it's very much independent learning as well.
hmm And how does it work in terms of your, how many years does it take? Because I remember some of the programs have 5 years, some of the programs have 6 years or something, right?
Yeah, so the majority of universities will be 5 year courses. However, and some of them are mandatory. You have to do 6 years, but the ones that are 5 years, you can do an extra year in the middle somewhere. It's called an intercalation, and you sort of take a year out of the core program to further your interest in a particular area of medicine and do something normally related to research or to teaching or something like that. Students can now actually also do master's degrees in the middle of their undergraduate um, curriculum, so within those 5 years. But yeah, most medical schools you can get through after 5 years, but some you have to do that additional sixth year. If you're a graduate entry, then it tends to be 4 year courses instead of 5 years, just because they put those first 2 years together. What I understand now is that the curriculum's a bit different. So in most universities now, we'll try to integrate more clinical stuff earlier on. So within that first and second year, whereas I did lots of sort of foundational knowledge, they will now put in a lot of clinical problem solving cases and group work and things to get people sort of thinking about the clinical side earlier.
Mhm. That's
I
kind
think
of
they call it more of a spiral slash integrated curriculum.
Mm. Do you have this thing? So, for instance, like in Russia, we have this thing in terms of your applied skills. It's Blondel to you as well question. For instance, like on the first, after the second or like third year, you do sorts of nurse practice. So you practice all the skills that all nurses have, such as like injections, some sorts of like any other manipulations. On the third and fourth year, you do sorts of like assistance to the doctors in different environments, such as like surgery or like therapeutics, or before your graduation, you do sorts of like a placement besides your like clinical rotations. You do a source of like a placement as a GP when you work like under supervision. Is that there like similar thing in? Let's start with Barbados.
Also, from our third year, we have something called clinical skills. So it's basically a building adjacent to the hospital, not in the hospital, but we go there and we learn to do things like set up IVs, put in NG tubes, take blood, which is called phlebotomy, and different clinical skills that will be helpful to you when you start your placements. Because remember, we didn't do any placements within the first 2 years. So
Mm.
an introduction into those clinical skills so that when you go on the wards and into the community, you will have these skills ready to use. As it really, and we also did something called case-based scenarios, which basically we were put into certain scenarios and we would have to come to a conclusion under the supervision of a consultant of how we would manage this case so that when we get into our placements, it's a similar situation. Um, yeah, that's how we did it. Not sure if Dougie's experience was different.
Ours is actually very similar. So yeah, when you start your clinical rotations, you have to become competent in a range of different skills. Some of those are nursing skills, and some of those are more doctor orientated skills. But yeah, you have to be able to do them all by the end of your clinical rotations. And yeah, what you said about working under supervision, yeah, we sort of do a lot of that within the fourth and fifth years.
Yeah, it's really nice. Because I reckon like what the type of examinations like OSCE in our area we have source of some of those examinations are sometimes similar, but the way you have those like OSCE exams, they really replicate the practice, which is kind of cool in terms of that. So yeah, great. I think my next question is, by now we've graduated from the uni. We've graduated from the uni. We got our like first degree. So the next question is masters. Yeah, both of you did masters in the sports and exercise medicine, and so because the thing which I want to understand now, I'll give some relevance. In Russia, you just finish up the like 6 years, and then you go straight to the residency. I mean, you do your like first six like foundational years, same thing as you guys have done, and you go straight to the residency. How does it work for Barbados? Blundell has already told us in terms of the residency, you have to go somewhere else overseas. But why do you
Medicine.
need?
For sports
Oh,
medicine.
sorry, yeah, sorry for some of the specialties. My bad. In terms of the masters, why did you need your masters?
Is this a question for me?
Yeah, sorry.
Okay.
Let's start with you, Dougie.
That's all
Sorry.
right. I think first of all, once you've completed medical school, you can actually do the masters straight away.
Hmm.
However, most people, so it's recommended that you work at least a little bit before doing a master's degree.
Hmm.
Um, not only because master's degrees are a step up and a little bit harder than the undergraduate degree, but also once you've worked a little, and you have gained competence in the clinical environment, it does actually supplement your learning and help you to learn on a master's course. Um, so yeah, once you graduate medical school, 99% of graduates will enter something called the foundation program in the United Kingdom, which is 2 years of you are working full time and you are a doctor working full time, but there is a little bit more supervision than there is at later stages of your medical career. But then, yeah, of course, you can just apply to the masters really any time. And as I mentioned earlier, you can even do a master's during medical school now, which is quite fantastic. And In terms of applying for masters in the UK, it's quite simple. I didn't try to apply for any masters overseas, so I'm not sure how that process would work. But yeah.
My question is in a bit different fashion. So basically, I think let's start first with the structure of how do you get into the sports. How do you become a sports physician, and then we'll get back to the masters.
Okay.
So yeah, basically, there is like really high competition in terms of like getting as a sports physician, as far as I get it.
Yeah.
So let's start with the UK. What do you need to do to become a sports physician?
Okay.
Uh,
So there's
mhm,
so you after you graduate medical school, you have to do these two foundational years. That's no
mhm,
matter what specialty you want to do, you have to do these two foundational years. After that, um, there's three different ways you can get to sport and exercise medicine. You can do GP training, you can do accident and emergency training, or you can do internal medicine training. And after 2 to 3 years of those training pathways, you can then apply to become a sport and exercise medicine registrar. Um, and then once you become a sport and exercise medicine registrar, you are that registrar for 4 or 5 years, and then eventually become a consultant.
All right. So just to make it clear for our listeners, so basically, do you have something like a residency in terms of like sports physician or not really?
So there is a specialty, yes, but for doctors in the early stages of their career, there's no sport and exercise medicine rotations. It's
Hmm.
not really a thing you can do. You can only do it once you've amassed at least 4 to 5 years of being a doctor and
Hmm.
apply for this specific training pathway.
So basically, as far as I get it, you have to finish your foundational training, which is obligatory for you to practice medicine.
Yeah.
Then you go for sorts of uh, so you so by the time you're getting into the sports medicine registrar, you have to obtain certain set of skills. Is that correct?
Yeah, that's correct. So, whichever pathway you go through after your foundation pro training, you have to have achieved a certain level of competence within that area. So, for example, someone who does GP training will have to pass all the GP examinations. Someone who does all the A&E, who takes the accident and emergency pathway, will have to pass all those examinations, etc. And when you apply for the specialty, as you mentioned before, it's very competitive. So it's good to have gained experience, lots of, you know, to have obtained lots of other achievements, got lots of other experiences, etc.
Hmm. And in this case, masters in sports and exercise medicine help you to gain some of those skills. Is that correct?
100%, yeah. So not only does the masters score you points on your application in several different ways, um, it also shows a very keen interest within the specialty.
Mm.
So in terms of how the masters helps your application, so yeah, the masters itself scores you points. Also, um, because you get to do research on your master's degree, it's a fantastic means of doing research because it's quite hard to do research otherwise within the healthcare setting because you're always quite busy. But doing research scores you points for your application, and then you might be able to present that research at conferences, and that also helps with your points for your application as well.
Great. Thank you very much. Blondell, is it something different in terms of like how would your way into sports and exercise medicine registrar would look? Would it be like a bit different or would it be the same?
So let me start by saying sports and exercise medicine is a very unique niche specialty. And that is why you have to start by doing either family medicine, accident and emergency, or what was the other one? Internal medicine. So internal medicine has literally nothing to do with sports and exercise medicine, but it develops you as a physician, okay? And you do gain core skills as an internal medicine physician and knowledge that can be used for an athlete because athletes are people, they're holistic people. All right. And so when you say, okay, I want to be a sports and exercise medicine physician, you know off the bat, oh, I just can't go into it. I have to work myself I have to work to get there, basically. I have work to do. In Barbados, unfortunately, there is no pathway. Hence why I said you have to go overseas. It's, like I said, a new developing, unique niche field.
Hmm.
The way that it has been done so far by persons in this island is that they do family medicine. So we have a doctorate of medicine in family medicine. So they do that, and that's 5 years. So they do 5 years of this DM in family medicine. and then they do the master's. So it's kind of backwards. So after they finish their doctorate in medicine, they do the master's in sports medicine. So they are a family physician
Hmm.
with an interest in sports medicine. That's how the majority of persons have done it so far.
Oh,
Now, as yes, now as medicine is evolving, they're realizing that really to be a sports medicine physician, you shouldn't have to do a full 5 years in a DM program. So they've started doing a diploma in family medicine, which is 3 years. And then after that diploma, then you do the master's in sports medicine. So you're still versed in family medicine, but then you go and you do the sports medicine masters afterwards. So that's kind of how people have been doing it here.
mm,
But yeah,
wow.
what I also say is that the masters in the diploma, sorry, the diploma in family medicine is very self-guided. You have to do a lot of work on your own. And also the master's is not an in-person master's like how we would have done it, where we gained a lot of practical skills. It's a online master's. So it's not as interactive. You do get a 2 week practicum, but you and I know that 2 weeks of practice is not going to be enough in this type of field. So
Mhm.
yeah, those are things to consider if you're trying to do sports medicine or follow the sports medicine pathway in the Caribbean.
Just like quick, also like off top in terms of this, that's really like complicated way to get like into the specialty because I compare it to what we have, 6 years plus 2 years, you're done. Yeah, we have our like drawbacks for this one as well. But I mean, in terms of the things that I've heard like about the getting into this like sports medicine registrar in the UK, I've seen that a lot of the doctors who's finished their like foundational years, then this training, they're already starting to work like in some of the like sports teams or do some like voluntary work. Then how is it regulated and what could you do being in that position?
A really good question. I think it's a little bit of a grey area, to be honest. So you're right. A lot of people do work within sports settings after they graduate, and um, basically you can work for, let's say, a sports team as a doctor, but you could also work as a first aider, and the insurance is slightly different. So you would have to have insurance covering you, um, and yeah, that's basically most of what you need, and obviously a team or sports setting to work in. But mainly, what people advise is that you should act as a first aider until you gain enough experience to work for teams as a doctor, because the responsibility is very different. And I think that was a fantastic thing about our master's degree was that we could work as first aiders and not have the responsibility as doctors whilst working in these environments, because it's lower pressure and you're still gaining the same skills and having the same experiences. Once you become a sport and exercise medicine registrar, that's sort of when, or when you become a fully qualified GP with the, let's say, a specialist interest in sport and exercise medicine, which is also a pathway here, and that's when you're more likely to be employed into the sports settings, and that's when you're expected to be able to act more independently and yeah, and you should be a lot more confident in those scenarios at that point. But doing it before you're a sport and exercise medicine doctor is a little bit risky, just because you haven't got the skills or knowledge or the supervision um, that is sometimes required in the high stakes settings.
All right. And here I want to ask one thing because like I'm not pretty sure about this one because we've had this funny thing when we were required a physio to cover the game, and I've asked you like whether you were able to come there,
Mm.
and it turned out that like medical doctor is not liable. Sorry, with the when you're done with your like foundational training, so you're fully qualified as a medical doctor, you're
Mhm.
technically not allowed to do this. So basically, did I get it right that most of the times uh, physios take lead for those like first aid rather than medical doctors before they become like a sports medicine consultants?
Yeah, so yeah, you are allowed to like cover some sporting events and things as a doctor, but yeah, it's much safer to do so once you're a registrar,
Hmm.
just because at that point you have supervision, because registrars act under supervision, and you also have more knowledge and experience of what you need to be able to do.
Hmm.
So yeah, most of the time it's recommended that you only act as first aiders until you are you have enough experience or are in the training pathway.
Yeah, this is kind of interesting because like in Russia, like when we have those conversations for people, it's always interesting to hear that physios are like those who are taking the lead in terms of that.
Yeah, yeah. Sorry, I didn't answer your question. Yeah, physios will often take the lead. Um, I mean, the role of a the doctor in a team is very different, and there's quite. I mean, it's different to physios, but also there's a lot of overlapping. And physiotherapists can do a majority of the first aid themselves, very competently. And but what the doctors are expected to do differently, such as if there's anything critical happening, or if there's anything very medical that the physios wouldn't understand, then that's sort of more their role. But yeah, physios can do most of it.
Yeah, that's kind of like very interesting because like in my country it's way different because like everything is under the doctors and physios are just like assisting them in case if something happens. Yeah, thank you very much. So yeah, now we finished this like let's say gray area and Blondell. How does that? I mean, do you want to say something about this like let's say like gray area? So how does it work for you in terms of?
Quite similar in Barbados, and as you could imagine, Barbados has much less funding and resources as in the UK. And so oftentimes when teams travel or even at home, they don't have a doctor, they just have a physio. And then they may have a doctor on standby, but they don't have a team doctor, unfortunately. There's just not enough of us. And so, yeah, the physios do take the lead quite often. And then when something serious happens, then obviously they have to get the doctor there or get the athlete to the doctor as soon as possible. Not ideal, but it happens. Yeah.
Yeah,
Mhm.
you. I think it would be maybe surprising you, but I completely agree with you, and I don't think that that's maybe ideal setting when physios take the lead in terms of that. But in terms of like the pre-hospital first aid, it may be source of something which is helping to save some of the resources of the healthcare. I think that's maybe the main reason why what has worked this way. So yeah, very interesting. And now we're moving to the finally to the stage when you're becoming like a sports registrar, sorry, medicine consultant. So what's your job then? What can you do after that? And what could be your like potential roles?
So our main roles would be diagnosis and treatment of sports related injuries. So we are going to evaluate acute and chronic musculoskeletal issues and plan a rehabilitation plan alongside our multidisciplinary team that we've learned during our masters. It's a whole team of us that we use. And also another thing that physiotherapists, I'm not sure if in the UK they can, but physios here can't order in any imaging. So if you require any further evaluation, then the doctor would be necessary for that as well. So as a doctor in sports and exercise medicine, you can work publicly or privately. Publicly, you can work in a hospital or in a clinic dealing with musculoskeletal injuries. And then privately, you can have your own clinic where you, again, deal with teams or individual athletes, again, with a focus on sports related injuries, if that's what you care to do. In the US and Barbados, I guess we do have something called physiatry. I don't know if you've ever heard of that. It's similar to sports. It's actually more all encompassing because it deals with a bit more than just sports related stuff. But in Barbados, we have one physiatrist here who helps or also does sports medicine. So that's another way that you can get into sports medicine as a consultant if you were a physiatrist. But that's a whole nother training pathway to
And in terms
complicate
of
things.
and in terms of, sorry, and in terms of the things that are not related to musculoskeletal, let's say like cardiac related or like respiratory related, is it's all up to you in terms of so basically you cover all everything that's related to the athlete's health.
You may still need or require to lean on your colleagues. So if you have an athlete, so yes, we would treat athletes with diabetes, athletes that have high blood pressure, stuff like that. But if say I had an exercise-induced asthma, but if I said, for instance, I had an athlete with heart failure or with heart disease, I would still lean on my colleague, the cardiologist, for help with treatment. Not yet at least, wouldn't do that on my own in terms of planning a rehabilitation plan and stuff like that on my own. I would still lean on my colleagues, my team.
And in terms of the, let's say, source of like precision screening or precision screening.
Yeah,
Up to you.
definitely. That's our role. What else would we be? So anything to do with travel. So if you have a team and you have to make sure all of their pre-travel screening exams are done, make sure their vaccines are up to date, because traveling you go to different parts of the world, so you want to make sure that they're safe when they're going over there. Nutrition is another thing. You work along with nutritionists to make sure that they're staying on target in terms of nutrition. Injury prevention is very important. We are responsible for education because that is a huge part now of sports and exercise medicine. You want to prevent things before they even occur. And then the on-site medical coverage for when you have your games. Then
And with regards to the, I think last question with regards to this one, because it's possibly also like on the sports and exercise medicine doctor related to the performance enhancement source of anything which is performance enhancement related. Do you do something
So
related?
I think that's actually something that's becoming a role in itself. As a sports medicine doctor, you can choose to go into doping and anti-doping. So yes, it is part of our role as you're dealing with the athletes to make sure that any medications that they're on or you're giving to them is not on the prohibited list. But it's actually also now a subset of sports medicine where you just do doping and anti-doping regulations, and you're a part of that body, whichever body it is, whether it is UCAD or over here it's RADO, where you work with those organizations to basically create and regulate the doping rules. Yeah.
And so basically you have source of like wide specialty where you can subspecialize in something, but it would be some sort of like non-official or like non-formal specialization. Thank you very much. Dougie, what about the UK? Is it different or?
No, it sounds very similar. So, sort of within sports and exercise medicine, there's three components. The massive one is musculoskeletal medicine. So, as Blondell said, investigating, diagnosing, treating acute and chronic musculoskeletal conditions, and that's probably the majority of the job. So you can do that on both a population and sort of a high elite level as well. Then there's the team medicine aspect, which encompasses all of the things you've sort of talked about already. And then there's the exercise medicine concept, which probably you'll probably be spending the least amount of time on at the moment, but it is quite a growing thing. So this more refers to public health and trying to encourage physical activity participation on a individual and sort of wider population level. So there's a lot of helping charities and guiding and taking part in initiatives and things like that. There's also sort of within exercise medicine, as you briefly touched on, sort of exercise-induced medical conditions. So things like exercise-induced asthma, exercise-induced laryngeal obstruction, and there's lots of exercise-related problems who GPs also refer to your clinic as well. There's GI problems, cardiac problems, and you have to sort of be able to do a bit of all of it really.
Great. And in terms of musculoskeletal medicine, in terms of the role of what's the difference between because in the UK it's pretty much complicated in terms of the subspecializing because the NHS is really flexible. You have, let's say, like physios. Let's make it easier. Let's say we have source of specialized physios in MSK. You have advanced physios in source of any. If you remember, one of our professors, Paul Matthews, he specialized in ankle injuries, and you may have, and you have sports medicine consultant. What would be the difference between three of them?
If I'm entirely honest, I don't think I've heard of a sports exercise medicine consultant specializing in a
Oh,
certain area of injuries.
sorry,
I
my
feel
bad.
like,
I meant that in terms of like sports medicine consultant, or yeah. So yeah, the consultant role. Yeah.
sorry, I don't understand the question.
So yeah, I'll go again. So you have, for instance, like physios who are specializing in MSK. You
Mm,
have advanced scope physios, and you have sports medicine consultant, right? Is it the name of the role, right?
yeah.
And as far as I get it, like sports medicine consultants, they also work in NHS, and they also do some of the work related to musculoskeletal system, such as like injections, ultrasound, etc. And
Yes.
would be the main difference between all those three specialties with regards to MSK.
Mm. That's very good. We touched on it earlier, but actually, they're starting. Normally, only the sports consultant could request scans, but actually, they are starting things where physios can start requesting some scans now, directly, which is very interesting. In terms of interpreting scans, that's obviously something that comes to physicians. Also, prescribing any sort of medicines. So, as part of the musculoskeletal sort of those sort of patients, treating them, you might need to prescribe some sort of medicines. Um, Physios can't prescribe medicines. Some physios can give injections, so they tend to be more privately done ones. But physios can give injections and do ultrasounds. And actually, I think a lot more physios know about how to do ultrasound than sports physicians, which is quite interesting. Um, Other differences, I think the role of the sports doctor is to be able to lead an MDT. So you have to be able to understand all the different um, roles within the MDT, whereas a physio tends to just be, they're obviously a part of the MDT, but they don't tend to lead it. So they
Mhm.
don't have to understand the, I don't know, the role of the nutritionist and the role of the cardiologist and the role of, whoever else is in the team. But the sports doctor has to be able to, you know, lead all members of the team and understand all those roles.
Uh,
But in terms of,
Great summary.
yeah, in
Mhm.
terms of the like core and like diagnosis and treatments, it's physios can pretty much do most things. There's some things during your sort of musculoskeletal assessment which doctors would be better at picking up. Things like more medical stuff like hernias, or like gynecological causes of hip pain and things like that. Um, but I know physios are taught to do very comprehensive reviews and escalate to the doctors if they are unsure about something.
Uh, Great summary. So yeah, just to sum up, the things which are very different, because like the things that you've mentioned in the UK, they have something that's called like advanced source of like practice in terms of physio. So sometimes they're allowed to. So not all physios are allowed to do ultrasound, just
Mm,
for our listeners, and not all of them are allowed to do like injections and prescribe medicines. And some of them are allowed to do some of those parts, but with the special training.
yeah,
And
you have to have done special training.
yeah, and with regards to the things that sports consultant is able to do, separate from that is just leading an MDT, being more advanced in sorts of different types of diagnosis, whether it's like musculoskeletal related or something else, and more proficient with the sorts of interpretation of the imaging. Yeah.
Yeah.
Good. Thank you very much. Well, we basically covered most of the questions that we have. Now we have two more questions to go. So the first one, could you go through the range of salaries that goes from, for instance, like since you graduate from the uni and then getting up to the consultant in Barbados and in the UK?
That is tough one, Pasha. So usually as an intern, so we do get paid to do that internship here. So I would say in US because that seems to be the best best currency to use for conversion purposes. Usually they start maybe around 30,000 US a year.
Hmm.
Uh, but like I said, it varies depending on where you're working. But that's about it. It starts around 30 as an intern. And then as you go and you so if as you we have a scale and as
Hmm.
you as your years pass on, so you become a senior house officer, then that will probably go up to maybe 50,000 maybe a year. It
100?
really
100, you mean?
depends. No, 50,000 US
50,
a
50.
year.
Mm-hmm.
As a SHO. That is in the public system
Mm-hmm.
because that's where we all start out. Privately, you can definitely make up to 100,000 a
Mm-hmm.
year for sure. Yeah, but it is very dependent on where you're working.
Mm-hmm.
Yeah.
Yeah,
Mhm.
I think it's a really good summary. Does Barbados have the what's called the progressive tax scale, such as in UK?
Yeah,
What's
yes.
the highest? What's the
They're,
range
I don't
from?
know. I don't know the different skills. That's the truth. I just know they go up, but I don't know. Yeah, I don't know.
Okay, never mind. So,
It's tiered similarly to the UK, but I don't know them. I'm sorry.
mhm. Uh, great summary to my mind. Dougie, something similar or is it different in UK?
Yeah, I just got it up on my phone actually. So when you graduate medical school, the base salary is 36.6 thousand. Um, and it'll go up sort of each year
US
pretty
or pounds?
much. Sorry,
USD? Or this is pounds.
this is in pounds. That's the base salary. But actually what you'll be earning is quite a bit more than that, probably closer to at least 42,000 when you start that because of all you have to add on all the on calls and night shifts, etc. Um, when you get into so we talked about the first two foundation years, and then the next part. So you have to do a few more years before you apply for specialty training. At the start of the second part, your pay is probably closer to 65, 70, and it has gone up recently. When you become a registrar, so start working within sport and exercise medicine, it's probably closer to 85, maybe a bit less, 80 to 85, I think. Consultant, I'm not entirely sure, but with a combination of both public and private work, it can probably be quite a bit. But those pays have gone up quite a bit recently.
As far as you get it, like the consultant could get up to 120 plus.
Potentially, I haven't looked.
Hmm. Yeah, thank you very much. It's a really good summary. And now we have the last thing, last bit. We'll start with the Blundell because we haven't seen you in a while. This would be like a blitz questions, like a quick quiz. We have to give answers without like pre-thinking much. And that would be the last bit because I reckon it's gonna be interesting. So you ready, Blundell?
Sure. What's up?
Okay. What was your favorite subject during the first 3 years in med school? I said quick.
I would say probably
First
respiratory
3 years.
system. Yeah. So when we
Anatomy.
did physiology and anatomy,
Right.
respiratory system. Yeah.
Okay,
I
good.
like I probably like the lecturer and how she taught, probably.
Hmm.
But yeah, I did enjoy that module.
All right. The next question is, what was the worst subject during the whole medical school?
Pharmacology.
Okay, right.
It was
Fair.
like a new concept to me, and like learning all the pharmacodynamics, pharmacokinetics, and all those different things. Always used to wonder if I would ever get the hang of medications and how they work. Luckily, after years of practice and stuff, yeah, it came. But yeah, pharmacology was horrible for me. I didn't
Okay.
like it.
Fair is fair. All right, let's go with the top three favorite clinical rotations.
I like obstetrics and gynecology. I had a lot of fun on that. I like general surgery because I love surgery, and I also liked, what was my third favorite? Probably another surgical specialty. Let's go with orthopedics. I like
All right,
orthopedics.
fair. Well, that's the choice I like. Yeah, that's the one I praise. All right. Okay, and the final bit, that's the toughest one. You have to make it quick, right? If it
Okay.
weren't for the sports medicine, then what? Okay.
ENT, because that's what I did before I did this.
All
Ears,
right.
nose, and throat.
Good. And the one you like, maybe some surgical one.
ENT is a surgical specialty, so
Oh
yeah.
yeah, fair. Yeah.
Yeah.
Yeah, I completely forgot that if I have something related to the ENT, the first person whom I would address my stupid questions would be you. Yeah, how did I forgot that when I had the pain in my ear, you get it. We've been through this with the tear and tear, so yeah, I've took Doggy's part, and yeah, the next one's there. Okay, Doggy, same thing for you.
Yeah.
Well, what was your favorite subject during the first 3 years?
Strangely enough, we statistics. So we did a lot about population health, and we did a lot of statistics, and we had to be good at statistics. I really enjoyed that.
Yeah, that's why you scored like Doggy scored the best. Did you score like the best score in terms of like our statistics or something?
Oh, the first module, yeah, I think so.
Nailed it. Okay, what was the worst subject for you?
Anatomy, actually.
Oh, really?
Yeah,
Which one?
I didn't like going to the anatomy suite and being with the cadavers. It wasn't for me, but I do enjoy anatomy generally.
Hmm. All right, good one. And what's your top three favorite clinical rotations?
I put orthopedics as number one. Um, Oncology, patients are very nice, and psychiatry actually wasn't bad. I like psychiatry. Very chilled.
To be fair, I would completely agree with you on those three, but except for oncology, mine would have been ENT. I pretty
Mm.
much enjoyed ENT as well, but I wasn't that smart as Blondell, so it didn't work for me. Okay, what was same thing? What would it be if it's not the sports medicine?
I think I'd be an exercise physiologist. Am I allowed that?
Well, no more to that.
Yeah.
Guys, thank you very much for your time. I think that was really interesting and interacting, and I would never expect it to be that well. To be
Mhm.
fair, one of the best podcasts I've ever done. To be fair, no kidding. Um, do you want to add something, or maybe
No,
Just
all I can say for people listening is that Pasha has helped me no end with my musculoskeletal examination skills. So thank you very much to him for that. He will always be the expert of the group, and I'll always be asking him about all my problems. So
yeah, I hope it
I
helps.
very much appreciate the time I spent with him and Blondell. Blondell also had a lot of interesting insights and further expanded my knowledge in the specialty. And I think that just really highlights how much you can gain from people from different countries and different, lines of work, etc.
Thank you very much, Doggy.
pleasure as well. And good luck to all of you there in your journey.
Yeah. Thank you very much, guys. Well, it looks like we have to do like at least another podcast so we could see Blondell like more often, but she has her, yeah, otherwise there is no other way you can get a single word from her except like, hey, hi, likewise. You get it. But I mean, no offense at all.
A few
Blondell,
words.
yeah, we truly appreciate that your expertise and your kindness was with us. No kidding. And thank you all for your invaluable English language lessons. Otherwise, I would have been still be yeah at the same spot I've entered the UK. Truly
No
appreciate it.
worries.
Yeah. See you around and yeah.
Yeah, thank you very much. Bye.
Bye.